Before I introduce our next moderator for the third panel of the day, I want to remind everybody about that bare set of boards back there. What we want to do back there, we have a goal: equip women to thrive in South Carolina's workforce. And we want your ideas and what you're hearing and feeling and living in your life about the barriers to that goal, the solutions to that goal, to achieve that goal, and most importantly, what are the commitments that you're willing to make in order to achieve that goal. So please do take a few minutes after the next panel to grab the cards or underneath it. There are markers, there's tape. It's a short little crafting project, no big deal. But we'd love to have, that's a way of documenting some of your great ideas and using them to go towards the recommendations that emerge from today. I now want to welcome our third panel to the stage, and I'm going to introduce the moderator who will then take it from here. This is our fearless moderator, Anita Garrett. Anita is the Director of Collective Impact at the United Way Association of South Carolina. She has worked in the fields of philanthropy and community engagement for more than 20 years, helping develop leaders, build capacity, and create public-private partnerships globally. She's a member of the National Women's Leadership Council of United Way Worldwide, the first African-American chair of Women in Philanthropy of the Midlands, and in 2016 coordinated the first statewide self-sufficiency study for South Carolina. So please welcome Anita and her speakers to panel 3.
Thank you, Anne. And thank you all for being here with us. It was so exciting to hear about the inaugural summit, and I'm so glad that we're holding this, and hopefully most of you all are going to participate tomorrow. Equal Pay Day, going to the State House. The timing is great. Yes, applause, applause. Yes. We are finally going to see women on the face of U.S. currency soon, in that Harriet Tubman, a former slave and abolitionist, will be bumping former President Andrew Jackson from the $20 bill. And so there are a lot of things that are changing on the economic front as it relates to women and the state of financial opportunities. However, as you heard this morning from Joey and our other panelists, that there are still a lot of things, there we go, sorry about that, can you hear me now? That have not changed. We still have a lot of hurdles. You heard about the 26,000 job labor shortage that we're facing, and there are some persistent gender gaps that continue to exist. So I have the pleasure of moderating this next discussion with a panel of experts who really work daily. And this is going to be exciting because we're going to look at it from a different vantage point and from the lens of these women who are on the front lines in addressing women's economic well-being and financial stability through their respective work. All of their bios are, again, in your conference brochure, but I'll briefly introduce them for us. So starting to your far left is Dr. Debbie Billings. She is the director of Choose Well, which is an initiative that is focused on reducing teen pregnancy and unintended pregnancies in the state of South Carolina. Following her is, who do I have? I'm sorry, my glasses are not focusing far enough. I'm sorry. Dr. Amy Crockett, attending physician with the Greenville Health System, and she's worked in maternal fetal medicine for a number of years and has won several awards, in fact, and you'll hear a little bit more about that as we go through the course of the day. Next is Dr. Stephanie Cooper-Lewter, who is with the Sisters of Charity Foundation of South Carolina. It's the only statewide foundation in South Carolina, serving all of the states still, and I think just recently celebrated its 20th anniversary. So thank you for being with us. Following that, we have Malissa Burnette. Malissa is an attorney and partner with Callison, Tighe, and Robinson, focused on labor law and is a certified specialist in that area, and it's going to really bring some good perspective to the conversation as well that we've not really delved deeply into yet today regarding the legal aspect of what we are looking to impact in this conversation. And then finally, Tamara King, Community Relations Director with Richland Library, and supervises the Office of Development at the library as well. So thank you, ladies, for joining us. So I'm going to open with a question for all of us. When you think about within your field and from your particular vantage point, the biggest hurdle that are facing women today still, in terms specifically of financial well-being and economic opportunity, what do you see as the biggest hurdle? And Debbie, would you like to start?
Sure, I'll start. So because we're taking this from our particular boxes or vantage points, I'll talk about issues related to access to contraceptives, otherwise known as birth control methods. I think one of the bigger challenges that we have right now, we've got the success of the Affordable Care Act, but which still has not been fully implemented here in South Carolina. So there are some really important struggles that we face still as women in terms of accessing, even when someone has health insurance, or and bigger struggles for women who are uninsured, and some real advances for women who are enrolled in Medicaid, and we can talk a bit about that. So there's a mixture of advances, but also some real challenges to basic access to contraceptives.
I'm an obstetrician, so my day job is delivering babies. So I know we've talked a little bit about family and parental leave already today, and to me that's one of the biggest challenges that I think the women that I see in my practice face. It's people who, and I treat women all the way across the socioeconomic spectrum. So things like needing to have lifting restrictions at a job, and does that mean that you're going to go out if I put your lifting restrictions at 30 pounds versus 20 pounds, and how can we negotiate, give you some strategies for talking to your boss about maybe you can do this without a doctor's note, because if I write this, they may just cut your hours completely. And so, that's always frustrating for them and for me, and but then also issues around when can I go back to work and I can't take this time off. And for students especially, I think that are missing pieces of classroom activities. They don't want to fail their semester and lose the tuition that they've paid when they're going to be out of school for 3 or 4 weeks. I don't think there's a lot of forgiveness on that side of things necessarily either. So that's, I think, one of the biggest challenges I see for working mothers.
Great, thank you.
Good afternoon. At the Sisters of Charity Foundation of South Carolina, our mission is to address poverty, and we do that through helping nonprofits who are serving individuals and families. And so I was really honored to join this panel because I think some of the questions in previous conversations throughout the day have been, what about the working poor? Those are women who don't have access to higher paying jobs, so maybe low wage workers. And just a few statistics, because I'm a researcher at heart and I love numbers. 13% of women across the United States experience poverty, but in South Carolina, 16.7% of women do. But when you peel back those layers and look from a demographic and disparity perspective, 25% of African American women experience poverty, 12% Asian, 27% Hispanic, 19% Native American, and 12% white. We know that women 65 and older represent 11% of that population. And then back to startling numbers, 42% of female-headed households in South Carolina experience poverty, and 24% of children grow up in homes that are poor. So that's 1 out of every 4 children. And so we know that nationally and in South Carolina, women make up 2/3 of the nearly 20 million, this is a national number, 20 million workers who are low wage. And when you say low wage, you think about women who may be cashiers, or the child care worker, or the dishwasher, or the food prep worker, or a farm worker, or a hostess, or a house cleaner, or a janitor, or a receptionist. So these are the women that we are particularly interested in. And so given this, we know that low-wage women have multiple barriers when they come into come into the workforce. But I also wanted to begin in my panel comments to lift up their strengths, because I think you can't have that conversation without identifying their strengths. So 2 women that I wanted to highlight that we've worked with and that we know is Isabella, and she was a mother of 2. She's an immigrant. She's lived here 13 years. She's raising two children and a baby on the way. And one of her children is on the honor roll. But if you remember back to the October 2015 floods, her particular development where she lived in the mobile home park got hit really, really hard. And she didn't have the resources she needed. She helped in construction. And so through one of our grants to Apostles as well as Homeworks, we helped to provide repairs for her home. This helped her tremendously. And it was really important because her child had asthma. And so the mold that was in her home could have been a huge setback to her and her family. And then one other woman I want to talk about is Jennifer, and she's a kinship care provider. So she is older, she's worked, she has a bachelor's degree, she is a 2-time breast cancer survivor. She's caring not only for her grandbaby, who she's had since 7 months of age, who was premature and had significant medical health needs, so she had to take off work to care for her, but she's also caring for her mother. And so in both of those instances, you have 2 women who are working really, really hard, but aren't making oftentimes livable wages.
That was interesting, Stephanie. Thank you. This was so hard. The question, what is one of the biggest hurdles to women for economic opportunity and financial stability? I've been practicing employment law for 40 years, and I said, how am I going to answer that question? There's so many things to think about, but it kind of came to me as I listened to one of the previous comments. In thinking about all the categories of employment, one thing that I've observed over the years is that traditionally female jobs, the wages go up if men go into those jobs, like nursing. You notice that? If more men start going into the jobs, the wages go up. When women go into more male traditional jobs, the wages start going down. So if women go into non-traditional jobs where there aren't many women, the wages are probably higher, but the atmosphere sometimes is more hostile, right? And I heard a comment from one of the panel members earlier that answered the question for me. And he said, one of the issues is when the women are trained and then they go out, they aren't ready to face the culture. They aren't prepared to work in that culture. And I said, that's wrong. What has happened is the employers have failed to change the culture. And guess what? Those employers have a legal obligation to change the culture so that everyone has access to work there. That is the law. And so in my mind, in my experience, that is one of the greatest hurdles that women have faced, is when they go into non-traditional, higher paying jobs, the employers have failed to change the culture so that females are accepted and can practice their skills there.
In March, the library partnered with WREN to have what we call these kitchen table focus groups. And it was really astonishing. So when we talk about what barriers women are having, we were able to ask that question of about 50 women. And we also traveled to St. Lawrence Place. If you're not familiar with St. Lawrence Place, it's a transitional shelter for families that are facing homelessness. And so we had this unique opportunity to have conversations, these kind of intimate moderator-led discussions about what barriers are really impacting them. So we're speaking from a very real place when I say, I think the number one thing I heard from these women was the diversity of different things that were impacting them, but the sameness at the same time. Like the things that impact me at my job impact them at their job. taking care of my daughter, making sure that I had the time off to take her to the doctor. That was a barrier for them. Going to work sick, how many women in the audience have had to do that, right? How many of us have said, we'll get that checked out later? Our daughters are more important, our sons are more important, our husbands, our loved ones are more important than whatever is going on with us. So I think one of the things that I took away from it was the need for a supportive work environment. And not just from men, because we kept hearing a lot about, yeah, men are rough on us sometimes too in our work environment, but women can be rougher. And so I thought, what does that say? What does that mean for us as we become managers and supervisors and legislative officials and get our chance at politics when we run and we do win? How do we make sure that empathy is still there? How do we remember what it's like to be a mom or to be someone who is just starting in a career and have that grace so that our sameness and our uniqueness kind of meet together? So I think that was the thing that I saw the most, making sure that there's supportive work environments and making sure that when we talk about creating laws, we don't just create laws for one type of woman, but there's an opportunity for all of us to be represented.
Wow, thank you. Thank you for those opening comments. Yes. So let's, and we'll make sure to save some time to open up for questions from the full audience, but I'm going to talk a little more specifically and ask you to speak a little more specifically on some areas that you all just touched on. So I'll start with Amy, if that's okay. So as a physician, could you talk a little bit more about your work around centering pregnancy and how that affects economic opportunity? We heard earlier someone talk about cradle to career. Many of us are familiar with that. So let's just start from there.
Yeah, centering pregnancy is something I found out about through a grant from the March of Dimes. It's a national model of group prenatal care. So instead of having traditional visits in the doctor's office one-on-one where you're by yourself, it brings groups of 8 to 12 women together for their prenatal care visits. So the visit starts, there's a group space that's big enough to hold all the women and their partners. Women check their own blood pressure, they check their own weight, and then they come over to, we have like a massage table where the providers, usually one of our nurse midwives or one of our physicians, will check, the belly and, what was your blood pressure today? What was your weight today? And so it really gives women a lot of buy-in and empowerment in terms of taking their own health information. And a lot of our patients didn't even know what the blood pressure meant, and now they know not only that it's important, but why. And then that first part takes about 30 minutes. So while people are getting individual checkups, there's some structured time in there for socializing, so you can start to build relationships and increase social support, because I think for a lot of women, pregnancy can be very isolating, especially if you don't have somebody who's a close friend or a family member that's been through it recently. You feel like you may be the only one struggling with some of the things and the feelings for pregnancy. And then the next hour of the group is spent in a circle, in a facilitated discussion. So we don't call it class. It's not a lecture like a class. It's a group discussion. And the curriculum includes some of the traditional kind of childbirth preparation topics and health topics, but also includes a lot of, just relationship building, and it's a chance for women to share the things that they're the most excited about for this baby that's coming, and the things that they're the most afraid about for the baby that's coming, and to work on solving some of those problems together. And we do a lot of research in our practice too, and we've seen really huge improvements in the rates of preterm birth for women that go through this pathway. Which is really exciting. Yeah, we see about a 30% reduction in the rate of preterm birth. And, that's the kind of improvement where if we could write a prescription for that, everybody would be selling it up like crazy, but it's not that easy. It's about changing your approach to medicine in terms of providing patients with the support that they need for each other rather than just the medical care. So we had for example, one of our groups came back for a reunion visit, and one of the moms walked in with 2 babies and 2 baby carriers, and we were like, "There's only one baby in your tummy. Where is this other baby coming from?" And it turned out that another woman in the group had been admitted for emergency gallbladder surgery, and she and her husband were both immigrants and didn't have a lot of family support, and so he had to go to work or would lose his job, and there was nobody to stay with the baby while she was in the hospital. And so this woman that she had met in her group was taking care of her newborn for the 2 or 3 days while she was in the hospital. And I remember thinking, if those women had been just sitting in my waiting room, they might not have ever even made eye contact with each other. And here this woman was in a true medical crisis, and what she needed was support from her community, and that I could give that to her just by changing the structure in which we're providing. And plus it was better education and helped her more with her healthcare needs too. So we've been working really hard to change what healthcare looks like and what healthcare means, trying to meet the needs that people have, which was not really to have her blood pressure checked as much as it was to have support when she had another crisis. So.
Wow. Talk about sisterhood. I mean, and someone said earlier, from a grassroots effort, each one teach one. That's a fabulous example. And I wish the baby would just stay in here with us because this is what this conversation is about. I'm so glad that she's joined us. But thank you for sharing that, Amy.
We've expanded that to 19 practices now in South Carolina, and we're working on more. So
Wow.
we've had more than 3,000 women that have
Centering
done.
pregnancy.
Yeah.
We're going to look that up. Thank you. That's a great example. And we'll continue in if you'll pass the mic to Debbie, since we're talking about health and the health field. Your work is focused on getting women access to the resources, and I know that you've seen some of the economic implications for both individual women as well as the state as a whole. And could you share a little bit with us?
So just a little bit of background. So the Choose Well initiative, we officially launched it after a lot of work building up to it. This February. It's a statewide initiative to reduce unintended pregnancy. And I just think it's really important to quickly define what that is. An unintended pregnancy is defined by the woman herself as either a pregnancy that's mistimed, like I wanted to be pregnant later, but not at this particular time, or unwanted. Never wanted to be pregnant or never wanted to be pregnant again. And there are some good studies, we need a lot more, that show the impact mostly in the immediate term in terms of not seeking prenatal care. So we get preterm births, low birth weight, all the way out through a life course effects in terms of educational achievement, employment achievement, and such. We need better studies, I will say that, in terms of those longer term effects. So we're really fortunate to be able to work with 22 partners right now throughout the state, Department of Health, federally qualified health centers, hospitals, et cetera, to really reach different populations throughout the state in an effort to reduce unintended pregnancy. The main mechanism, it's not the only one, but the main mechanism is expanding access to contraceptive services. I always somewhat laugh about my job because I feel like this should have been done 30 years ago, and why are we even thinking about this? But we are, and we need to. So I think something to put on the table is, as we've heard throughout the day, and we all recognize, the diversity of women and women's experiences in the workplace as just one space where diversity takes place. So we've got situations of women working in agriculture who are undocumented, who cannot be insured in this state, even if they wanted to take money out of their pocket. They cannot buy health insurance. We've got women who are low income, enrolled in Medicaid, and Medicaid has made some real advances in terms of contraceptive access. We've got women who are insured, but where the insurance companies are not necessarily complying with the Affordable Care Act still, and those contraceptive methods are quite expensive and incurring out-of-pocket costs. So I say all of this because I think when we talk about the economic impact on women of unintended pregnancy, or even the contraceptive access itself, it really varies in terms of who that woman is and what the contraceptive is costing them. I just want to throw out a statistic that I thought was really interesting. It was a study done by the National Business Group on Health, which is a membership group of large private and public sector employers. And this study estimated that it costs employers 15 to 17% more to not provide contraceptive coverage in employee health plans than to, thank you. Yes, Mac, yes, exactly. It costs employers more money to not cover contraceptive services than it does to provide such coverage, but than to provide coverage only for maternity care, pregnancy care, and such, and those indirect costs incurred by, paternal or parental leave. Now, I say this, and I feel like we have to be really careful in the way that we express these kinds of results, because in no way, there's a fine line when we talk about these issues of let's provide coverage for contraceptive services, but we also have to have the conditions under which women and men are able to make their own decisions. And where I see the fine line is where we start verging into those sort of that gray area or very clear area of coercive policies, which is absolutely where we do not want to head. We are not, in our initiative, framing any of this because this is not the issue of certain women need to have access to certain forms of contraception because their births cost us too much money. That is the way, and sometimes these issues are framed, and we need a serious reframing of these issues if we're going to put it as where it should be in a context and a framework of social justice, reproductive justice, and just justice, period, right, and equality. So I'll pause there.
Great, thank you. And I like how you put that, the reframing. And sometimes we, when we're talking about the economic impact and poverty, there is a tendency to frame the discussion in a certain way, and we want to make sure that everyone is able to understand that this affects all within the community, whether you're a woman or a man, whether you're an employer or an employee. So that's helpful. And speaking about poverty, I had the opportunity, you can keep the mic, Stephanie, to work with several community partners in coordinating the first self-sufficiency standard for the state of South Carolina. If you're not familiar with it, there are actually some extra handouts, I believe, somewhere in the back. And it was a study with partners such as the Sisters of Charity Foundation, Children's Trust, and others that finally allowed us to sort of drill deeply and find out what specific costs are for individuals to be self-sufficient economically, financially, and what that looked like in every state in our county. So Stephanie, as you work with poverty and the foundation is looking at the challenges, are there some specific challenges that you've seen for women that are living in poverty? And I know there's our kinship advisory group and others. What are you observing in that realm?
Absolutely. We're seeing a lot of things. In addition to things that every woman may, or many women may face, if you're juggling work and family, low-income women, to your point exactly, often struggle with health and having health care access, as well as getting good health care coverage. And so they can easily be derailed by an illness or an injury, so that can knock them back. They may not have paid family leave or medical leave benefits or sick days. Another area that I think is really unique to low-income women is the lack of transportation. That's something that we often don't think about, but having either not owning a vehicle, having unreliable public transportation that extends the workday, or just having inconsistent rides here or there. So if you can imagine taking public transportation, and in many places that's not good at all, or it's really hard to do, but that might add an hour or an hour and a half just for you to get to work, which means if you have children, they're also need longer care. So that is a huge barrier that we see. In addition, affordable and available and adequate and reliable childcare. So if you think about low-wage workers who are women, they may be doing evening shifts, maybe not the 9 to 5. And so having childcare that's accessible and affordable for them is something that we also see. And finally, in addition to lack of employment opportunities, also the education and training gap. So we know that 40 to 50% of women in female-headed low-income households in South Carolina have no post-secondary education. So we need to get them trained. We need to figure out where are the gaps in the workforce and prepare them so that they have the skills that they need to move forward. So it's a huge, huge issue around employment as well and education.
Men and women, any of us could be just, one flat tire away from falling into that gap. And when you're talking about having to catch the bus and then take your child to daycare, how many have done a poverty simulation in here, right? So that's what this is real, and so many individuals across our state and our country face this every day. Go ahead, you.
I want to share one story. I love stories. And when we were traveling across the state for listening sessions, where we went into different communities, rural and urban, in one community we held a luncheon where we invited community leaders of nonprofits, but we also asked them to bring with them people that they have served so that they could come, because we really wanted to hear their stories and their perspectives. And I'll never forget, this was our very first listening session in Allendale, and a woman came up to me at the very end after we held this lunch, and we're at small table conversations, and she came up to me at the end and she said, "I want to thank you." And I said, "Why?" And she said, "Because I've never been invited to a lunch and to have people to listen and think that my voice or my story was important to hear." She said, "I felt invisible." And so that really, I'll always remember her, because here was a woman who you could tell was struggling, was on the margins for a number of reasons. She shared a little bit of her story. And for her just to be seen and noticed as a valuable person in the community for a $10 lunch that we take for granted, many of us in this room. So I think that that piece of what it actually takes, and she came to that luncheon because someone she knew, someone that she built a relationship with, someone that she trusted at a nonprofit invited her and saw her worth and value. And so I think that's part of the message we also want to send to low-wage workers.
Thank you. Malissa, as an employee, we're talking about pay and pay equity. As an employment attorney, you have fought for a while for equal opportunity, equal access, and I know that it was very interesting. I had a chance to talk before our panel discussion today, some of the South Carolina laws that we need to address, and some very interesting facts that our audience might not be aware of. Can you speak to some of that?
Well, not only the South Carolina laws, but federal laws as well. This is an at-will employment state. You've heard that term. Some people mix that up with right-to-work state, but it's really an at-will employment state, like the majority of states in the United States. People don't know that. But at-will means that a worker can be terminated for a good reason, a bad reason, no reason whatsoever, an unfair reason, a wrong reason. And it's legal. Someone cannot be terminated for an unlawful reason, such as a breach of contract or violation of a statute, meaning a law that's written on South Carolina code books or the federal code books. So, lots of times, I'm beating my head against the wall because I normally represent individual workers, and people will call me and say, well, this happened to me today, and it's so unfair. It's got to be illegal. And it's so hard to comfort someone when I agree it's unfair, but it's not illegal. That the boss hired his nephew, and so you're fired. That's unfair, but it's not illegal in most cases. So we start with that premise, and then we look at the problem of, especially for women, might be a couple of others in this room who worked for the Equal Rights Amendment like I did in the 70s, which we really, really needed. We needed a constitutional amendment so that we don't have to have the employment laws. The one most frequently used is Title VII of the 1964 Civil Rights Act and the State Human Affairs Law. It only covers you for equal employment if you work for an employer with 15 or more employees. And a lot of women call me who work for mom and pop business and say, well, these guys are getting promoted all around me, and I trained them to be promoted over me. I'll say, well, how many employees are there? 8. I say, I'm sorry. They can be paid double you. You double what you're being paid, and you get to train them. But you're, too bad. It's not illegal. What? It's not. It's not. So, there are gaps in the laws without the Equal Rights Amendment. So that's a problem. And we talked about pregnancy. What's unfair is not illegal. Pregnant women will call me and say, I got a doctor's note that says that I can only lift 25 pounds or less, but my employer wants me to lift more than that. And I'll say, well, you're pregnant, right? But is a normal pregnancy? Yes. You don't have a disability, because pregnancy is not a disability under the Americans with Disabilities Act. So they don't have to accommodate you unless you have a disability, unless you have a pregnancy complication that is causing you to have a disability as defined under the Americans with Disabilities Act. They do not have to accommodate you. Now, sometimes there are disabilities that occur during pregnancy, but otherwise, the employer does not have to accommodate you, and they don't have to accommodate you still unless they have 15 employees. So that's a problem. I'll have women call me who think they're entitled to vacation or some kind of leave to pick up their children. South Carolina law does not require any employer to provide sick leave or vacation. Well, if you work for government, it does, but not for private employers. Doesn't require any of that. No leave, no vacation, no time off. Family and Medical Leave Act, FMLA, you might have heard of that. I'll have women call me who become pregnant and think they're going to get time off for their pregnancy. And I'll say, how many employees? 25. Well, unless you have 50 employees, you're not covered by the FMLA. Well, what if they do have 50 employees within 75 miles? Well, how long have you worked there? 6 months. Well, you haven't worked there long enough. You have to work there a year and 1,250 hours. And all kinds of rules, okay? So women need to know their rights before something happens. Breastfeeding. Everybody thinks they have a right to breastfeed or express milk on the job. Not if you're a manager, just the hourly employees under the FMLA, and only if there are 50 employees. I could go on.
Unfortunately.
I have to say no more than I can say yes. Don't have too many rights. But fortunately, I can help. It sounds like I can't help anybody. But lots of times I can. But, you know, I hope women will educate themselves before something happens, before they make decisions about their lives, so they know when to do it, how to do it, so they don't get kicked out of their jobs.
And, you know, we talked about culture earlier and organizational culture, and it sounds like, unfortunately, many of the cultures are really expecting women and their biological clocks to adapt to the workforce and not the other way around. So we've got a lot to change. I think it was Moria earlier that said we really need to look at how we can make those changes in the State House, and she should run, and in ways in which we can change some of that laws and legislation, but it begins by us at least being aware of it, because there was a lot of information there that I wasn't aware of as well. So this panel discussion is called Breaking the Barriers. So let's pivot for a moment. And if you would, and anyone can begin, let's talk a little bit about the game changers that, as you see them, that will help us break some of these barriers. We're looking at health, literacy, education, community development. What are some of the game changers in your perspective that can help us break through some of these?
One of the things that we continue to see in all of the focus groups, and I continue to see just in my normal walk through the workplace and where I work and the women that I know, there are resources there, but let's provide the access to those resources. Yes, transportation is available, but is there access to that transportation for women? Healthcare may be available, but is it affordable? Is it accessible? So I think that's one of the game changers, is making sure that there's a pathway to set people up for success, and they are able to have the access to resources.
Thank you. I actually attended this was years ago, a conversation that the library hosted. They are such great community partners. I mean, they've got a one-stop, is that right? A workforce development, like up on the second floor. You guys need to check it out if you haven't been there lately. They are doing some great things in the community. And there was a conversation that was being held there on transportation, and some women from a local shelter had come over to express their voice. So thank you all for what you do as well. But access is just as important as having the resources. Melissa, where are you going to?
I think playing off of that, I saw a great letter to the editor, or maybe an editorial in the paper, that diversity is not the same as inclusion. And those of you who have an opportunity in your companies to have an impact on true inclusion should have a say in that. You can have diversity where maybe the numbers look right, but is there really inclusion? Are women and minorities really included in everything, or is it just to look good on paper? Is everyone invited to the party all the time? And how can we need to speak up when we see that not happening. We need to have the courage to speak up when that's not happening, and not wait for somebody else to speak up. I think that's really important.
I love what you said, and to add to that, diversity, equity, inclusion are really key markers of how we move forward. Diversity is present, who's actually present at the table. I think of inclusion as perspective. What range of perspectives do you have you can be at the table, but you may not be given the microphone to speak. And so who also has that ability to influence what actually is being said? And then equity is the outcomes. How are outcomes changing? How are those disparities that we care about most changing? One game changer that I see in addressing families that experience poverty is that of two-generation approaches. So that is looking and exploring the needs of women, mothers, or parents, as well as at the same time simultaneously addressing the needs of their child. So earlier today we heard about early education and some really key markers for children. So if we take two-generation approaches to working with families, we're likely to get the parents as well as the children and move them all along in the continuum. And part of that work also includes not only education and training, which we talked about, but also mentoring and the social capital, which is relationships. And so I've often heard a quote that says, education and relationships are the two key things that can move someone out of poverty. And so without those relationships, without someone who can show you, this is how you apply for a job, or this is what you wear to a job interview, or this is how you answer the phone at your work, those are all key things that need to be taught if you haven't learned it along the way. And so I think we need to employ more two-generation strategies across South Carolina.
So healthcare at the end of the table. There's a lot of change right now in our industry, and so it's hard for me to comment on that without really being clearly partisan. But one of the things that when I'm teaching the medical students, a lot of them come in really focused on the physiology of what's happening, the doses of drugs they need to learn to give, how they technically complete a surgery or deliver a baby, and one of the lectures that I give for them is about looking at prenatal care in particular, but health care in general, within the social framework of the patients that we take care of. So this very small slice of time that I have with somebody that may only be 10 minutes or 15 minutes, although things can happen in that space that change their life, it's all the things that they bring with them when they come in to see me, the neighborhood that they live in and the food that they're eating and how far they are from the hospital and whether or not this visit is paid for or how they're going to get their medications covered when they leave. All of those pieces are more important almost than the time that I spend with them. And so, voting, running for office, those kinds of decisions are just as important way of taking care of your patients as learning what the right dose is of the different medications. So, who knows what our future will be, but as long as we keep advocating for those principles and putting, I encourage advocacy for all I think physicians in particular have a very powerful voice that's not often at the table because we're very busy taking care of sick people, and I think that's a shame because I think as long as you can keep the patients at the heart of the decision making, that's really where the the power is in that conversation. So.
Deep. Thank you.
Thank you. So in our Choose Well vision statement, we kind of turned responsibility on its head. And so many times when we're talking about especially contraceptive care and pregnancy and such, it's the individual's responsibility. Why didn't that woman do such and such, right? And we kind of turn that on its head and say, yeah, we're not negating the importance of individual responsibility, but all of us in this room who have our, those positions of decision-making and power have a responsibility to create the conditions that make it possible for women and men to choose, in this case, the contraceptive method that's going to be right for them at that particular moment in their lives. Because if we don't have policies, if we don't have infrastructure, if we don't have funding, if we don't have insurance companies that cover these methods, you can choose, you can make those decisions in your head, but you can't really act on those decisions, and then you get blamed. So I just want to call out one opportunity that we have right now, collectively in this room. Under discussion right now in the legislature, in the House, is a 12-month contraception bill right now that would allow women to get their hormonal contraception for 12 months at a time. That gets paid for. You don't have to worry about, as soon as you get your pill pack, all of a sudden I'm worried about, how do I get the next month's pack? The system we have right now does not make sense. And so anything that we can do to support this kind of meaningful, commonsensical legislation is part of creating that policy base, those conditions by which we enable people and help people to be able to act on what's right. Now, there are some insurance companies that are fighting this. And there's been discussion at the State House in these hearings of, women might take this and sell it on the black market. And I keep saying, if somebody gets rich off the black market of selling their contraceptive pills, more power to them, really. That's creativity. The reason this is so important, there was a study done, and I'm just going to summarize it really quickly, going back to what we heard in the morning about the gender gap in wages, that said that the contraceptive pill can account for up to 10% of the shrink in the gender gap in the 1980s, when full-time women workers' salaries rose from 60 to 69% of men's salaries. And subsequently, the pill can account for up to 30% of the convergence in the gender gap in the 1990s. I can give you the citation if you're interested, but that is to say that contraceptive access is incredibly important. It's not the only thing that's important, but it plays a role in reducing this gender gap in wages. And so just my final comment is really us being able to mainstream family planning, contraceptive care as part of preventative care. It's not something that's out there, separate, that's optional, that we can pick or choose whether or not we cover it. It's a basic preventative health care issue that needs to be covered.
Thank you all. So the feminization of poverty is not new, but it is very real. And there are some opportunities that have been presented here, and there are a host of others. So what I want to do is make sure that we have some time for some questions from the audience. And if we can do that now, that'll be great. So, hands. All right, we've got one.
First, Debbie, hey, how'd you know it was me? Shouting. Two things real quick. Something I think we missed on the last panel, and something I would like each of you to state is, we're here to talk about making more money, and one of the simplest ways to make change, is to donate. So would you please list, I know, I just redid my house, so feel free to donate. But Debbie is part of an organization that I know is a nonprofit and would be happy to take your donation. I talked to Eddie, the lovely man who was our sole, oh, you in here? Eddie, stand up. Can we give you cash and money? Thank you for your organization. Okay, so if y'all will take a second and just tell us if you're not directly a part of an organization, one that, like Doc, one that, you think is a good one to give our financial support to. And real quick, even though I am This is a wonderful, wonderful conversation. A lot of this is we need to remind ourselves to hold men accountable because they're half the equation with making babies. Okay, thanks. Who do we give money to?
I say, Choose Well is located within New Morning Foundation. We're fortunate that we've got some good funding, so I say give the money to Eddie. And Planned Parenthood.
Sorry. Right. Yeah, I support Planned Parenthood as well. Also, March of Dimes, South Carolina chapter of the March of Dimes is fantastic. Our local chapter of United Way also has been extremely supportive of the work that we've done. And I'm also part of South Carolina ACOG that has a lobbyist this year for the first time, which has made a huge difference in the work that we're able to do at the State House. The ACOG, American College of OBGYN. Yeah.
So how much time do we have? We fund across the state. I think we grant several hundred, 100 to 200 grants a year across the state. So first couple of nonprofit organizations that come to mind. So we don't need the money, but they do. Anderson Interfaith Ministries up in the upstate, they have a Women and Children Succeeding program that removes barriers to post-secondary education. Their outcomes are phenomenal. In 2015 to 2016, they had 32 participants in the program and 15 graduated college. There is PASOS, that's an organization that's statewide that serves immigrants and immigrant families. I could go on and on and on and on. There is, if you're interested in kinship care, there is a program in the Charleston region called HALOS, Helping and Lending Outreach Support. They provide support services for grandparents, aunts and uncles, raising relatives' children. Go to our website, our director. I'm going to direct everybody to our communications director over here, and she can give you a whole nother list of nonprofits across the state that are working every day, from the food pantries to the clothing to the employment opportunities to just a range of organizations. And we're lucky to partner with a lot of nonprofits doing this work to lift families out of poverty. And I love a quote that says, "We rise by lifting others." So when we get someplace, we have to make sure we do our part to lift others along behind us.
All of those are wonderful. Of course, people who have been fired have trouble hiring a lawyer, right? And there are very few resources. So I hope if you can, you could support the South Carolina Bar Pro Bono program. That's one really good one. Also, the Palmetto Legal Services Program, and they will, in particular, help people get through the unemployment process if they can't manage it themselves. And of course, Appleseed, you've heard of Appleseed, does a lot of really good work.
I echo that all of those are wonderful organizations and should definitely deserve and need your support. But the Richland Library has a foundation, and through the Richland Library Foundation, we're able to provide different programs that are specific to women and also education and information. We have something, one of our career specialists is in the back, and our social worker, they're both in the back. Woo woo, Lee and Andrina King back there. We have, Richland Library is one of the few libraries that has a social worker on staff that helps people. They take appointments. They help everywhere from managing the Affordable Care Act while it is still in existence, and also a number of other issues like Medicaid and SNAP and financial help and financial aid assistance for college students. We also have career specialists that will not only walk you through your career journey, but help you with your resume. They do interview practice. We have something called a family career studio at the library on the 3rd floor, where you can, it's an enclosed space so your children can run around while you're working on your paper, while you're working on your resume. So the library has been very intentional about how do we provide access, like we talk about, helping people get that access to information and resources that they need, and being a convener for different partnerships with nonprofits in our community. So the Richland Library Foundation, I have to toot our horn for a little bit about what we do and we're able to do through the Richland Library Foundation. Thank you.
I would also add WREN to the list. Make a plug. I have the microphone, so WREN, I don't know if you've heard of it.
We definitely don't want to forget WREN, scren.org. And you can go to 211.org to search out other organizations across the state to find out those things that you might be passionate about and connect with organizations like WREN and the library and PASOS and others. So I just love that we're actually doing some solutions. Emmy, there's a question here.
Hi, it's actually a comment.
Or a comment.
I just want to make mention for anybody who owns their own business or has the power, there are matching programs. You can always think about a matching program through your company to encourage your employees to donate as well. And if you work for a company like United Health, for example, does a triple matching program, so I'm able to donate and then make kind of more of a dent. So
Smart. Leverage those dollars as best we can. Other questions? Thought I saw another hand. Ann has one.
Thank you. One thing that hasn't come up, but I know you all work on and care about a lot, is violence. And domestic violence, also sexual harassment. We can't go a day without hearing about some new issue related to workplace violence, harassment, and we know that domestic violence is a huge problem in South Carolina, and it affects every aspect of women's lives and certainly of the financial stability of their families. So would love to hear thoughts that you all have, what you see in your own work and what you see as some of the potential solutions are.
Well, of all the employment prohibitions, the one that some employers and coworkers think is still okay is sexual harassment, and in spite of it being unlawful. I still see that going on all the time. It's covered by Title VII of the 1964 Civil Rights Act, but of course you have to have 15 employees for it to be covered. Otherwise, you're left with having to use the criminal law, assault and battery, or use the civil law for civil assault and battery or whatever claim you can make, and which require a whole different set of witnesses and so forth. So it's difficult, and it's still very prevalent in the employment arena. And there is violence. Now, one good thing about unemployment, the unemployment law was amended so that if someone has to quit their job or leave their job due to domestic violence, that does not prohibit them from receiving unemployment. There's a specific statute about that, so at least that. Anybody else want?
I just wanted to share one example. Domestic violence certainly has a huge impact on so many families. And at the Sisters of Charity Foundation, we meet usually with nonprofit organizations, so it's pretty rare if someone kind of stops by unannounced. We usually have appointments, and I'll never forget one day when a woman came to our office and she pulled on my door. And I knew that, okay, she must not know because this is not the door that you come to enter into the office. And so I kind of waited a minute, and then she pulled again. And so I went and unlocked the door and had her come into my office. And she started to cry. And she said, "I'm looking for, you're the sisters, right?" And I said, "Yeah, we're the Sisters of Charity Foundation." She's like, "Can you help me find a place for me and my children tonight? My husband has abused us. We have to leave." And he's left 13 cents in our bank account. And what I realized in her talking was that she was actually looking for sister care and had somehow mixed the names up. And so I was able to pause and look up the number and make some phone calls and try to connect her exactly with the organization that she needs. And so this was just someone she just Googled and ended up finding our foundation. And luckily we were able to connect her to a resource that I hope was helpful for her. So it has a huge impact on families.
The intersection between gender-based violence and contraceptive use or care is very multifaceted, but I'll just highlight two areas. One where we know throughout the world of situations where contraceptive use is forced on women, so it's a form of violence. My neighbor is the ex-governor Hodges over in Shandon. I love that man. He apologized for South Carolina's eugenics policy years ago, where forced sterilization was not just an individual provider decision, it was a policy in this state. So as we work in our realm and through Choose Well, we're also very cognizant of and constantly recognizing that history of coercion and violence against women through the contraceptive method itself. So that's one dimension. Another is women using contraceptives, needing to use them clandestinely because their partners won't let them. And that sort of privileges certain methods like Depo, where you're not gonna find Depo, right? You're not gonna find a pill pack or anything. So there's that whole area of work. And then the third, I lied, I wanna highlight 3. The third is in situations of sexual violence. We've got services in some hospitals, for example, with SANES, sexual assault nurse examiners, and that is wonderful. And women have the right in this state to access emergency contraception, which prevents pregnancy. It's not a form of abortion, although it gets touted as that. Emergency contraception, they can access it. Unfortunately, in this state, if a woman goes to, for example, a hospital post-assault, that providers in that hospital do not have to present that as an option to her, sort of proactively. So women need to know when they get to that site, that hospital, for example, they need to know that they need to ask for it. And on top of everything else that's going on in their lives in that particular moment, to have to remember to ask for and demand a certain service so that they don't become pregnant from that sexual assault is pretty daunting. And that seems incredibly unfair, really, to say the least.
Hi. So my question is for probably you ladies on the end. So one thing is that when I was from the age of 16 to the age of 22, I got to go to I'm from Kentucky. I got to go to my health department and also my school, my college nurse, and walk away with a brown paper bag of 12 months of birth control pills. So I didn't have to go to my county wherever and have everybody, I guess, see me get my birth control. So that was very helpful for me as a young woman. And it was sort of surprising for me to hear that we're having this discussion here in South Carolina, because that was in the 90s. The other question that I have is, so I've worked as a doula and done a lot of studies about birth and that sort of thing, and I love hearing that you guys have the group prenatal classes, because from everything I've read, it seems to be very effective. I wanted to ask about supporting women during pregnancy and childbirth, because what I see is that it seems like it's one of the places where we tend to have an authoritarian attitude towards women. You know, bring in the woman, it's, you know, there seems to be some choices that women could make that are maybe not presented as choices. And I think that's a critical time for women to be empowered as to their choices and as to how they start their own family, and to sort of be told, well, you have to lay in this bed and you have to be strapped to a thing, and you know, you have to have your knees pushed into your chest. That sort of thing seems to be kind of one of the ways that we still kind of chip away at a woman's authority over her body. So I'd be curious as to how you know, some of the ACOG changes that are maybe happening, and how you see those things being put into practice here in South Carolina that would empower women. Thanks.
Yep, absolutely. We are all reading the things from ACOG. I think I would also say there's a lot of commercial pressure on OB providers, because women, you know, ideally are pregnant by choice, and once they are pregnant, they can choose their OB provider and where they're going to deliver. And so in general, for hospitals, that's a pretty lucrative service line. It's 2 admissions, including the neonatal admission. And so there's a lot of competition, particularly in the bigger cities, to get women's business. And I think you know, those of us that provide obstetric care are well aware that women want options in childbirth. So we actually the company that installed our birthing tubs. We have representation here, so we have tubs for labor and delivery that were installed in our hospital. We just built a freestanding birthing center that's across the street from our hospital in Greenville. We have monitors that are remote, so you could get up and walk around and still be on the monitor and not necessarily. We are huge proponents of VBAC, or vaginal delivery after cesarean section, in our hospital. Now, that being said, South Carolina is a big place. There are 44 birthing hospitals, and not all of them have the same attitudes about choices in childbirth. And so, but I think that there's a lot of commercial pressure, and that demanding what you want and being clear about what's important to you and going somewhere else if you have the means to do that is, that speaks very loudly to hospital administrators, and so I would just, again, continue advocacy on that. But I think, in general, it's moving in the right direction, and that, people are looking to the, 3 major teaching centers who are all moving in the same direction to kind of set the tone for what's going to happen in the level 1s and level 2 hospitals. So I think it's moving in the right direction to empower just women's choices.
There's a question on this side. Richland, you got the mic? I was just telling someone my daughter-in-law just had her second child, and I learned, and they're on a military base outside of this state, but I learned that she is going to have to go back to have a procedure instead of having her tube ligation, her tubes tied immediately following, to go back. And as you were talking just about, it's a billable procedure, and there is a sign, if you haven't seen it, there's a woman who's about 90 years old who was fighting for some of our rights, and she was marching and said, I can't believe we're still fighting for something. Yeah. Because I can't say that totally, but I think you're right. Go ahead.
So on that issue of needing to come back, South Carolina is really in the lead, and I will say Amy is part of that leadership in this state and in this country. We were the first state to pass a Medicaid policy, so women who are enrolled in Medicaid are now able to access, if they want to, immediately before leaving the hospital postpartum, either an implant, which goes into the arm, or an IUD postpartum, so they don't have to come back to the hospital. The significance of this is that if it were billed out, it would be around $1,500. These are not inexpensive contraceptive methods. And so the fact that that within Medicaid here in the state, people were visionary enough to say, let's figure out how to cover this if women want it, and visionary enough to then invite Blue Cross Blue Shield to the table to say, oh, this actually works. We're going to cover this too. And so that is something that we're constantly, when I say we, I mean here in South Carolina, getting calls from all over the country. How did you do this? How are you implementing it? And it's exciting to be number 1 in that area.
Thank you for sharing that. Yes.
Hi, I'm Andrea Johnson with the National Women's Law Center. I wanted to raise one other barrier that women experience in the workforce and see what experiences you've had with this. This is something we see particularly for women in the low-wage workforce is unpredictable schedules. And it was kind of touched on with the childcare comment that you made, which was great, but just incredibly unpredictable schedules. Workers are given just a few days, if that, advance notice of their schedule. They'll show up to work and then they're sent home early, or they're asked to be on call. And we're not talking doctors here, we're talking retail workers. They're asked to be on call. So that means you have to arrange childcare, pay for childcare, and then maybe you're not going to make your income that day, and you're making minimum wage, and so that means, the difference between having dinner on the table or not. Is that something that you've been seeing in your line of work? All of you, I think that goes to you, and I'd be interested to see the impact that also has on getting health care when you have no say in your schedule and accessing a good doctor and things like that.
Yeah, I'll be brief. It's the group visits are scheduled 6 months out. So for me, that has when I had the capacity to block my schedule 3 months from now and 4 months from now, it's great. But we have a lot of patients that are reluctant to join groups because they don't know their schedule and they want to add the hours at the last minute. We do provide childcare during the groups because a lot of people have unpredictable childcare, and that having a baby with you or a small child with you in group is distracting from what's going on. So we have a really great partnership with the YMCA in Greenville that they help us provide childcare for, and high quality childcare, because I think that's another issue. A lot of our patients have been very skeptical and reluctant to leave their children in childcare because they've not really had positive experiences with that in the past, but we've talked a lot about what quality childcare is and why we've chosen this provider in our office. But for sure, that's an option. I've seen it go both ways, with women liking the predictability of groups and not liking it. But I'm curious too about the legal piece of changing schedules. And
yeah, that's a really big problem, and I'll get calls sometimes, say there's a plant that has 3 shifts, and a woman might call and say, well, I've been on first shift ever since I started working here, so I had all my child care planned around that, and I was told yesterday I have to start working second shift. How can they do that? They can't do that to me, because I can't do it. Nobody can pick up my children, nothing. And I said, well, I know you're an at-will employee, you don't have a contract. And I said, right, they can do it. And, that woman probably is going to have to quit, or she'll be fired. Because if your employer says you are going to go from first shift to second shift, you either go from first shift to second shift, or you don't have a job. And that's just how it is. And it's, that's how it is.
One of the things we saw when we did the focus group, especially when we went to St. Lawrence Place, when you talk about those low wage earners, that was a real issue about childcare and how do I get my needs met while also making sure that I am able to go to work. One of the stories that sticks out in my head was there was a lady, she had diabetes, a brain tumor, and heart issues, and she said she had to travel all the way to Hilton Head because no one here in South Carolina, well, no one here in Columbia, no Medicare provider took care of all of the things that she needed. And a lot of providers won't take Medicare for specialized care like she had. And so she has to take off a day from work, travel all the way to Hilton Head just to be seen. That's a real problem. And I think we all sat around the table looking at each other thinking, wow, if I hadn't been in this room and talking to these women, I wouldn't have known that was a major issue. Another woman that really brought tears to all of our eyes is a woman who just graduated with her GED. She's got 3 children. I think she's 19, had horrible, just had a horrible experience in school. And she was saying how she struggled to even help her children with their schoolwork. And being able to do that and juggling her work environment and making sure that when she takes off for her children being sick, how can she take off for her being sick as well? So these are real issues, and I think when we sat in that room, I can't remember who else was in the focus group with us that night, but it was became very clear to us that those people tend to think, I was just talking about this, that if you're poor, there's a belief or a stereotype that you're lazy, or you don't want it bad enough, or you can't pull yourself up by your own bootstraps. But that is not the case. I can't think of anything harder sometimes than being poor and having needs and not being able to meet them. That is a hard place, and if you're a mother, it's even harder to look at your child and know that you can't meet their needs. So I think that's a real issue, and I don't know, I don't know if I have the answer, but I was really curious. We're talking about us here, but let's talk about these jobs. How do we make sure that our employers are able to have some humanity? We met a woman who worked for 2 months on a broken foot because she couldn't take off. She knew her foot was broken, but she worked as a woman at a gas station. She was a clerk at a gas station. And she killed herself trying to work for this job and then was ultimately fired because the person that she trained messed up. After she'd been there 2 years, and she was in tears because what do I do now? What is my next step? How do I get help? And she had health care challenges as well. So I guess I bring all that to bear because I'm like, the question is, how do we impress it upon employers how important it is to have that supportive work environment? I guess I'm asking a question rather than answering, so I'm sorry.
Well, thank you. And that's the question for the entire audience, right? What do we do now? What do we do now? It's complex. This is not a one-woman battle, and it is going to take all of our solutions to come together. So with that, I want to thank our panelists. Thank you for being here, and I'm going to turn it over to Anne.